Hi guys, we have a case of a 40-year-old female with a lower abdominal pain. Let's get started. So I'm just going to quickly scroll from top to bottom to see if anything catches my eyes. So right when I scroll, the liver kind of looks weird. Instead of being in the right side of the abdomen, the liver is more anteriorly. And I don't know which side is the right side of the liver and which side is the left side. There's the fissure for the falciparum ligament. There's a portal vein. The typical portal vein branching of right and left is different. I guess this is the main portal vein right here, and then it gives off the branch on the left, the branch on the right. Now, this person has heterotaxy. The other thing I notice is that see these are all, this is polysplenia. This person has multiple tiny spleen, and the spleen, instead of being on the left side, it is on the right side. Um, so is this a duplicated right side of the liver or duplicated left side of the liver or right and left side? Because one can probably argue that the caudate lobe right here, does that make this right lobe? I don't know. Clinically, just for the purpose of the acute abdominal pain, stereotaxy shouldn't matter. And also the stomach is on the right side of the patient as opposed to the left side. Let me just quickly scroll down to see if I see any pathology. Here's our pancreas. I didn't see any inflammation around the pancreas. I stopped by the kidney. I didn't see any inflammation around the kidneys. I didn't see big stone. I didn't see hydronephrosis. As I scroll down more, I talk about this idea of like dirty fat a lot, which is anytime you have inflammation in the abdomen or pelvis, the fat around the inflamed structure, there will be edema, increased blood flow, and that would make it more white. So for example, if you compare normal fat around here, here, or here, there's definitely increased inflammation in the fat around here. Now, let's try to find out what this is. So immediately my thought is that this looks like cecum. It's coming out of here. There's something dense here that could be a fecal lid. So that I'm thinking is the appendix, and I think this is acute appendicitis. I didn't see any fluid collection adjacent to the appendix that would tell me there's an abscess. Um, I didn't see any definite free air to tell me that this appendix has perforated. But let's just try to follow the ball. So here's our rectum. Here's our sigmoid colon. And see, there is some inflammation around the sigmoid colon as well, but this inflammation is from this appendicitis and not from any pathology in the sigmoid colon itself, because the appendix is way more abnormal than the sigmoid colon. So let's go. This person does have some diverticulitis, some small one, like right one there though. And again, the bowel is kind of weird too, because remember, normally the descending colon should be the most posterior lateral structure, and here there's all these small bowel loops lateral and posterior to the descending colon. So uh, I, I don't know exactly how to describe it, but the anatomy is definitely unusual. So I'm coming down here, and hold on, I think. Uh, Hold on, let me just try to follow it first, and then. Okay, I'm able to follow it. So this is the cecum. As I keep going up here, this is my transverse colon here, and right here it's coming this way, sorry, and here, and here, and from here is my descending colon. So I was able to follow the colon all the way down. This is the, where did it go? Okay. This is the cecum. the appendix coming out of the cecum, and this is the terminal ileum, like right here. So this is a case of acute appendicitis. Let's look on coronal. Again, this is the cecum. This is a big appendix coming out, and normally we say that the appendix should be usually less than 7 or 8 millimeter in diameter. This is way bigger than that, and all this inflammation around. We can quickly look at the vessels to see there's no thrombosis. And in this case, it's kind of hard. I would say this should be the superior mesenteric vein coming to the portal vein here, and then our spleen was on the right. So let's see what our splenic vein would be. So this should be the splenic vein coming out here. And I'm going to the spleen. Let's just look at the arterial anatomy really quick. I'm just curious. So the first branch coming out of the abdominal aorta should be the celiac trunk. The celiac trunk normally gives rise to the common hepatic and splenic artery. So I think right there should be the splenic artery branch, just because it's coming towards the spleen. I lose it here, probably there. I didn't see the common hepatic artery. Sometimes the common hepatic artery can come outside of the superior mesenteric artery too. So let's see if it comes that way. So this is our superior mesenteric artery, and it does give out a branch here. It's hard for me to follow, but maybe that happens again. Clinically, in this case, it doesn't matter. This is a case of acute appendicitis, but definitely some interesting anatomy. Let's just look at the answer. So typical appearance of acute appendicitis due to heterotaxy with polysplenia left isomerism. So isomerism just means mirror image. So what Dr. Hartung is saying is that the left side has a mirror image on the right. Now, usually for isomerism, if it's a chest isomerism, then what sometimes we could be talking about is that so the left lung has its own branching pattern of the bronchus, and if you have a left isomerism and we're talking about the lung, then we know that there's a duplicated left lung. Or if you're talking about the heart, then it has to do with cardiac chamber in terms of left isomerism. I'm not so sure. Maybe the left liver is duplicated. That's why he's calling it a left isomerism. I mean, the spleen, I see it on the right. I don't see spleen on the left. So so this is definitely heterotaxy because the spleen is on the right, the stomach is on the right, the liver is on the midline slash left. I'm not 100% sure about why he's calling it left isomerism. This is definitely polysplenia with a bunch of spleens. But yeah, case of acute appendicitis. Thanks for watching.